Hello, in this video I'm going to show you some of the bones of the skull and some of the bone markings of the skull. Starting here with the frontal bone. These two small bones here are the nasal bones. These are the maxilla bones, zygomatic bones, mandible. If we look in the orbit of the eye, we can see several bones. Close to the orbit, the nasal bones. This is maxilla here. This small bone here is the lacrimal bone. It has a little hole in it. Behind the lacrimal bone, making up the medial wall of the orbit of the eye, is the ethmoid bone. The ethmoid bone is a cube-shaped bone that sits between the eyes. We'll look at the ethmoid bone from another view in just a moment. Back here you can see a small circular hole, right? That is the optic canal, also known as the optic foramen. So your optic nerve runs through there. We'll be able to see that from a cranial floor view also. Next to the optic canal is a larger opening. This is part of the orbital fissure, as is this here. So this part of the orbital fissure will open to the cranial floor view. This part of the orbital fissure opens into an inferior view. This bone here associated with the fissures, this is the sphenoid bone. We'll be able to see that from a lot of other views too. This is zygomatic bone here. When we look at a close-up of the nasal cavity, we can see several bones. These are the nasal bones up here, the maxilla. This is called the nasal septum. It's the wall that separates the right and left halves of the nasal cavity, and it's actually made of two bones. The upper part is made of a portion of the ethmoid bone called the perpendicular plate of the ethmoid bone. The lower portion is composed of the vomer bone. The vomer bone is an odd bone. It's rather thin here in the front, or thin's not the right word. It's small here in the front, and it grows taller as it goes back. So we're going to look at the vomer bone from an inferior view. We'll be able to see it much better. These structures here are called the middle nasal concha, and they are also part of the ethmoid bone, like the perpendicular plate. These structures here are the inferior nasal concha, and they are actually their own separate bones. Okay, now we're looking at a lateral view of the skull. So you can very clearly see that parietal bone here on the right. There's one on the left. Almost all of these bones are paired right and left. We're just going to look at the one side though. So here's the temporal bone. And the temporal bone has some features on it that you need to know. Like this opening here, this is the external acoustic meatus. When you stick your finger in your ear, that's where you're sticking it, right? This large bump here is the mastoid process. Some muscles in your neck will connect to that. So that's also part of the temporal bone. You can't see it very well from this view, but I'll show it to you from another view, is that there is a bowl-like structure right here, and that's called the mandibular fossa. So this bone here is the mandible, right? And this portion of the mandible is the mandibular condyle. And the mandibular condyle forms a joint with the occipital bone at this mandibular fossa. It's called your temporal mandibular joint. It's also known as TMJ. And you might have heard of this because in some people this joint pops out. It can be pretty painful. You can also see a little bit of the occipital bone here from the lateral view. This is one that students often struggle with. This is the lateral view of the sphenoid bone. This is the zygomatic bone. So this is called the zygomatic arch, and it's made of both temporal bone and zygomatic bone. We can see ethmoid bone, lacrimal bone, maxilla, and nasal bone too. Here we're looking at the cranial floor view of the skull. So I've removed, right, the lid, so to speak. So this is anterior. So there's, you know, an orbit of the eye here, another orbit of the eye here, and this is posterior down here. Okay. So these are still the frontal bones. So this is that ethmoid bone I've mentioned before. It's a cube-shaped bone that sits between the eyes. So this is the superior portion of the ethmoid bone. This bone here that's kind of shaped like a butterfly or a bat, that is the sphenoid bone. This portion of the sphenoid bone is called the sella turcica. It kind of looks like a saddle, like for a horse, and your pituitary gland sits in here and is protected by that bone. Here you can see some light coming through. This is that optic canal or optic foramen seen from the cranial floor view, right? I kind of showed you it earlier in the orbital view right there. And then we have the superior orbital fissure here. Again, that goes to the orbit of the eye. This is the occipital bone, foramen magnum. So your brainstem and spinal cord will go through here. This jagged opening to the left and right of the foramen magnum is the jugular foramen, and your jugular vein will run through there. This is temporal bone here and over here. So this is an inferior view of the skull with the mandible removed. So this is the upper jaw here, the maxilla, right? So maxilla here, here, and here. These are the palatine bones here. So the maxilla and the palatine bones make up the roof of your mouth. This is zygomatic bone here. Zygomatic arch. So this is temporal bone here. And of course on the other side too. So I had mentioned that we're going to have a better view of that mandibular fossa, and this is it right here. So this is that mandibular fossa that your mandible will fit into. Let me grab the mandible and show you. So you can see how that mandibular condyle of the mandible fits into that mandibular fossa, forming your temporal mandibular joint. There's another view of the external acoustic meatus and mastoid process. So you can feel this bone, if you feel behind your ear, you can feel that big bump of the mastoid process. Take that mandible back off again. So this actually is the nasal cavity running through here, right? So this is that nasal septum we talked about before. And I mentioned the vomer, right? I said there's a better view of the vomer, and this is it. So all of this bone right here is all vomer bone. So it's rather small on the anterior side, but over here on the inferior and back, the vomer is rather large. So we can also see the sphenoid bone from this view. It's kind of oddly shaped. There's a real thin piece of sphenoid bone here, and then all of that is all sphenoid bone. Same on the other side too. And then we have occipital bone, right? Of course, this is the foramen magnum. These are the occipital condyles, and they are going to form a joint or articulate with the first vertebra called the atlas. This bump here is called the external occipital protuberance of the skull, and muscles will attach to that. This opening here, we saw this on the cranial floor view. This is the jugular foramen here and here. So these jagged openings to the left and right of the foramen magnum, the jagged jugulars. That's how I remember that one.